All right, welcome to TIL Talks with Chris White, where we talk TILs, tumor infiltrating lymphocytes, and all advanced cell and gene therapies, both with patients and caregivers, along with industry leaders. Let's get going. As a reminder, I am not a medical professional or medical expert. I am only a professional and expert on my story and my experience. If you are needing or seeking medical advice or assistance, please reach out to your care team. All right, welcome back for part 2 out of 2. As promised, picking up just where we left off, and let's get going. In today's episode, I'm talking with Mr. Bill Heyman. Bill is a melanoma patient survivor due to a clinical trial through the NIH and is a TIL therapy treatment recipient. And I am very grateful to have Bill on TIL Talks today. Here we go.
So once you get to the IL-2 phase, it's pretty much a recovery situation at that point. But there's a couple interesting things that happen early on in the recovery. So one of which is it's a very common side effect that after you receive your TILs back, all the, in my case, 130 billion lymphocytes, for new cells to immediately go to your lungs. So one of the things that they really look for and monitor is how well your respiration, making sure that it doesn't overwhelm your lungs. And the other thing that tends to happen is you get rashes. I remember getting rashes. Once I was out of the ICU and they moved me into a regular room for recovery, I actually started experiencing itchiness all over my body. Itchiness like I've never experienced before in my life. And also at this point in time, my hair is basically coming out, which was a side effect of some preparatory chemotherapy.
They give you, it's called Atarax.
Was Atarax, which actually is I know I've mentioned it to some people and they're like, that's a really old drug, like it's been used for decades or a century or whatever.
A little bit of sedative and properties, because I remember them telling me this would also help with that, because I was super uncomfortable. Like when you live in a hospital bed for a while as you're going through all this, like, it's not comfortable. So anything that can help. But I was gonna ask, I was like, I hope you're about to tell me they gave you Atarax.
Yes, I got Atarax, and that was, I mean, before I had Atarax, I thought I was gonna like peel my skin off. I mean, it was just horrible. The itchiness. I've never experienced anything like that. But once the itchiness subsided, the rash subsided, at that point it was just a recovery phase. And my recovery phase lasted maybe a couple weeks, I think. And they were monitoring my white blood cells. I forget what the measurement was, whether I had to be over 5.0 before I could be released. And I think 6.0. It's the ANC number. I think 7.0 is normal. Maybe 5.0, they would let me actually get out of the hospital. 6.0, would release me. So in the context of my life and what was going on with my wife Jody at that time, and my challenge, my personal challenge I had during this time period was I need to get stronger now. I need to be able to feel stronger, get better, so I can get home and take care of my wife and kids. And that was my single-minded focus during this time. As soon as I hit whatever level, I think it might have been 5.0 or 6.0, whichever it was for my ANC, they would let me out of my room because at that point my immune system was enough that I wasn't going to like, get ill and contract things out in the environment. I would start walking around NIH, and as I got stronger, I'd walk around outside the NIH campus. When you're hospitalized at NIH, which is a research hospital, it's different than any other hospital I've ever been to in terms of some of the freedoms you get as a patient that you don't normally get. Once I hit a certain level, they would let me out of my room. They would let me roam the building. At another level, they would let me go outside the building. And while I was recovering towards the end, they actually allowed, my sister-in-law was staying with me at the time. I really want to get some fresh air and go for a walk. And so we walked from NIH to Bethesda to go to a Mexican restaurant where we ate lunch and then walked to the National Cathedral. We toured that. I had never been there before. And then from there, we went to the Washington Zoo. And the Washington Zoo is kind of on a hill and you go down to the river and you walk back up. And it was really tiring walking back up. But I walked from NIH to the National Zoo down to the bottom, not quite to the bottom, but close, and then back up and back to NIH. I was so determined to rebuild my strength. that I did that. And I think that was helpful. And
That
soon I,
blows me away. They let you like you're not discharged,
no, I'm
but
not
they let
discharged. No.
you but they let you literally walk outside of the building, leave the campus, go out to eat, and
Yes.
then come back. I'm sitting there trying to imagine that. Like I felt like I was on like, top tier security, like, prison guard watch.
Yeah.
Like I'm sitting here thinking like, shit, you must have been in like county work release, is what it sounds like.
Yes. Yeah, it's weird. And NIH as a research hospital is different in certain ways.
Like, is it still like that?
I have no idea whether it was just the nature of why I was. Even when I was going through, until I was doing my preparatory regime to TILs, I had a room in the hospital and yeah, I check in and check out. As long as they had a way of calling you and contacting you, they were good. It's just a different experience. So anyway, I was so determined to rebuild my strength, and I was able to do that. And then they discharged me. I got to go back to Minneapolis and then attend to my wife and kids and recover more. When I was home, I would say that initially I was about 50% maybe of my normal strength, but day by day it increased and it got better. About 6 months later in March, my wife passed away. Then I basically was a single dad at that point. Now, for initially they would have me, so the first 3 months I would go back to Washington DC every month. And then after that it would be every 3 months. And then they advanced it to every 6 months. And they would basically do a combination. One visit I would be doing CT scans, another one I would be doing CT scans plus MRI of my brain so that they could monitor me.
You're traveling from.
Yeah, I'm traveling from Minneapolis to Washington, D.C. every month, every 3 months, every six
Are you
months.
dri Are you driving or are you flying?
Flying.
Okay. Okay.
Now, one thing that is different about NIH as a federal research organization, my treatment did not require any sort of insurance at all. It was all federal research dollars that were paid for my treatment.
All that you came out of pocket for nothing. They covered it
The
all.
travel, treatment, the whole shebang.
Like literally, this very moment is the first time that this has hit me, and I literally did not understand or know that because it's expensive if you have to
Oh,
go out
without
of
doubt.
state. Wow, dude, that is incredible.
In these days of chaos in the government and NIH, I would beg and plead that cancer trials, the National Cancer Institute, be spared because of the amazing, incredible work that the National Cancer Institute researchers, including Dr. Rosenberg and his awesome team, are doing. And I couldn't express how horrified I would be if I hear that the spigots to his research and that research is cut off. Federal research at NIH for in the National Cancer Institute is like amazing, and I'm living proof of it. And there's no way I can express enough gratitude to the National Cancer Institute and Dr. Rosenberg and his team for what they've done for me and basically given me a new lease on life. I'm living bonus time.
And this is you're 12 years past infusion, right?
Yeah, so August 30th, 2012 was my infusion. Today is February 6th, 2025.
So you're at like your 12 and a half year anniversary. This year will be your 13th year anniversary
Yes.
from day zero.
So one thing I have to say is those first 3 months, I went back every month. They do scans. And the first month I went back, they said, oh, your tumor load is reduced by 33%. Month two, oh, your tumor load is reduced by 67%. Month three, your tumor load's reduced by 99% or more. And what's left, we don't know if it's active or if it's just scar tissue.
Do they say the words calcified or necrotic?
No, they didn't use either of those terms. Whether they knew or not, I don't know. But they monitored me, so I went back 3 months on a 3 month cycle for a few times, and went on 6 months. After about 15 months from my treatment, they said we can't see that scar tissue or whatever we saw before. You're NED, no evidence of disease, and we're classifying you as a complete responder in our trial. So those were like hallelujah.
That's like a freaking. It sounds like the 4th of July, Christmas, and your birthday, and all the best holidays you can imagine, all rolled into one.
Yes, yes.
Like, did they have you continue to come in and scan every 3 months after that for?
Well, yeah, so they went to a 6 month cycle and then they went to a 1 year cycle. And then I think at the very end they were Well, after about 3 years, it might have been after 15 months, they actually asked me. They're like, you've responded so well to this treatment. We ask if you'd be interested in allowing us to use your cells, your tumor cells, as well as the cells from your genome to help us determine why you responded so well to the treatment. And so, of course, I signed and use my cells forever, whatever you want to help future cancer patients. I'm so grateful for having this extension of my life that it's just the least I can do offer that for research. So I was going back there. I think I went back there for maybe 9 years, just over 9 years for follow-up.
9 years?
Yeah, so 2021 or so, maybe 2022, early 2022. They actually, I went in, they said, still don't see anything. Oh, by the way, we're kicking you out. Basically gotten everything we need from you. And it was kind of bittersweet because I enjoyed going back to DC and seeing everyone. But of course, it's great to be kicked out of that program for that reason. So here I am. I'm here today to tell my tale. And as a true complete responder, one question I had is, it's a question that everyone would want to ask of their doctors in this case, like, am I cured? And the doctors are always they're shy about making such a proclamation. What they're like is, well, if you survive this therapy after 4.5 or 5 years, our research has shown that 98% of our patients that have gone through this therapy and have been complete responders at that, well, not necessarily complete responders, but who survive 4.5 or 5 years will have a long-term durable remission. That's what they call it, long-term durable remission. And as far as I'm concerned, that's good. That's as good as a cure for all practical purposes. And it's awesome.
I'm glad you brought this up because I am extremely cognizant. I am very intentional. And every time I share my story in every interview or every whatever it is that I do, that I very clear about, like, I don't use the word remission. Because the way the treatment works, it was not explained to me like that. It works for me. If you go to look it up, what remission says and what remission means is that it's dormant, it's asleep, and that it could wake up again. But the way that it was explained to me and the way that it works for people like me and people like yourself is that it eradicates it. And that means in order for it to be remission, it means that it's still there, but it's asleep and there's a possibility for it to wake up. But when it works like it did for me and like it did for you, it's not there. And so therefore it doesn't have the opportunity to wake up to go rain havoc. And the whole thing is that if it did, then your TIL that are still in your body, that you got like your long-term security, you know what I mean? You got your mercs.
Your body has been retrained to recognize your cancer cells.
Yeah. And it's like before it can even pop its head over the trench, it'll get pop, pew, pew, pew. I've talked to a lot of different doctors, a lot of different clinicians, a lot of different patients, and I guess you would say like a taboo nature of talking about using the word cure and cancer in the same sentence. I don't see it that way. I use it, and I don't give a shit. But I will.
We're not doctors. Doctors can't prove that there isn't one cell somewhere in your body that can outwit your immune system. But for our purposes as patients, yes, it's a cure.
Yeah. And so for my own like cognizant sense, if I'm roaming around thinking like it's gonna come back, that's not gonna do me any good.
No.
So as far as I'm concerned, and it's maybe feel the same way, when it yields a result that continues to benefit you and your scans are proving so, your labs are proving so, you know what I'm saying? Like it does no benefit to sit around and go like, I could be coming back, you know what I mean? It's just like what you mentioned earlier, it's a customized like VIP experience. Whatever made you sick is the same thing that is going to cure you. It's to me, it's the only thing that makes sense.
The reason why I chose it as a trial.
Like I never understood the science when it all came down to. I had my whole thought process was backwards, Bill. You know, my whole thought process was like, if it's approved, then it's gotta be better, and therefore I should do those first. Not knowing that when it all comes down to it, both approved therapies and treatments and clinical trials all literally have like the same type of efficacy But the difference is that within clinical trials that make it to FDA approved therapies, they go through that process, the rigorous testing to prove that, hey, it's there, but there's so much benefit to clinical trials. And when it comes to advanced cell therapies, autologous cell therapies, and I use the word autologous because
Mhm.
it's non-modified, it's customized per patient for that patient. It's a living biologic. It's not off the shelf. What works, it's not like you can go borrow it from somebody else. I mean, it is
Right.
so just straight up like customized for you. Whatever it caused you to be sick will be the same thing that cures you.
Right. Yeah. I mean, one of the interesting things and one of the interesting challenges for NIH when doing this treatment under trial was the fact that the FDA really had a hard time classifying how to approve these because every single patient's TIL is different. So how do you approve that?
I've been in meetings the last year in multiple different settings where we have the FDA there, and it's topic of conversation is like, how do you figure out how to get these living biologics through approval on whether it's an RMAT status, an orphan drug? Because these are novel new modalities that don't have a precedent to be like, oh, here's the path of what always done. So it's this collaboration effort of how do we get these approved? Because there is a need, there is a population, and when you have a disease or a cancer that's rare and or is non-effective to standard of care, or is what's considered standard of care, it like your best options.
So NIH actually had to get FDA approval on my specific, thing of bottle of TILs for them to give it back to me on a trial. So one other thing I wanted to say about my treatment is in terms of side effects or after the treatment. The primary side effect that I've had during treatment is what's known as vitiligo. And vitiligo is where basically your melanocytes within your skin go away and you almost become albino. And in my case, I was always pale and light skinned. So it's not terribly noticeable that I have vitiligo. Although if you look in my elbows or my knees and around my joints, you'll see, particularly after I've been under the sun a little bit and a little bit tan, where some of my melanocytes shine through, I look like leopard skin. The most visible aspect of my vitiligo is actually my hair. So I was blonde before treatment, and I call it platinum blonde, gray. I have white hair now. So, but if that is the worst side effect of my treatment, I'll take it.
Bill, that's actually, I mean, I had the exact same side effect. And I don't know about you, dude, but, the white eyelashes and the white hair, I've been approached and connected with plenty of people that, it's a very positive thing. I mean, there's people pay a lot of money to get our color. They literally will go pay to get that. And I've been before by like people I've known for 30 plus years. If anybody's ever asked me if like I'm albino because of the light tone and the white eyelashes and stuff, but I'm mucosal melanoma. You're not mucosal melanoma. But once you go through this treatment, which is for unresectable metastatic melanoma, no matter what the origin is, this is a side effect. And so
It's a positive side effect. It means it's working.
exactly. It's the same thing I talk about when discussing like going through IL-2s and you have the cytokine release. When you have the side effect for Rigers, that is a positive result that it's working because it's like you just close your eyes. And I don't want anybody listening to this to imagine this, but close your eyes and then just imagine like a pool of gasoline and then you throw a match on it. And then what happens? You can like just literally see it spread and just like light up. And that's what happens when you get used with your TILs and then you get IL-2 is it just like sends it flaming and going and it's moving, acting, and that's a good thing. So
Yeah.
vitiligo, the white hair, all of that, I embrace it. I openly admit when I first started growing my hair back and when it came time for my very first haircut, I was a little self-conscious and I actually went and dyed it brown because I didn't know how to handle shit. Didn't understand the mental health aspect, and it still hadn't even hit me that what was going on. I was like living in this Fight Club world, but after it started coming in and everything, I didn't do it again, and I just kind of let it grew out. But that's a super positive thing when that happens and you go through everything that you went through. And then these are the permanent side effects is having this platinum silver foxes, gray hair, light skin. You know what I'm saying? You'd be like sun sticky. That's a phenomenal thing because, and I'm sure you might concur with this, but every day I still wake up and it's never left me, man. It's been now 5+ years since I walked out of the hospital from that. And it's been now almost 12, 13 years for you. But I still remember vividly what it was like going through everything leading up to that, my whole entire hospital stay, that kind of trauma, good, bad, or ugly, dude. Like, it does not leave you. That's why I do what I do.
Thank you. I thank you for being such a patient advocate.
Well, dude, let me just lay this out here. Like, I'm going on now my 7th year since diagnosis, 5+ years since last treatment. But for people like me, what I wanted and what I needed was to know people like you that have had a unresectable terminal type of diagnosis, you know what I'm saying, a stage 4 diagnosis, went through a treatment and it worked. And you have like twice as long. So then, therefore people want and they need something to look forward to. Where's the example of somebody that had, what I had, did the treatment that I had, and what are their results? Because especially when it comes to advanced cell therapies, TIL therapies, modalities that are these one-time curative treatments, they have to use that word curative. That is so important. Man, like I remember meeting Jamie. She was the first person that I met that was under Dr. Rosenberg. Prior to meeting Jamie, I met one other person that had done TIL, but she was an ocular melanoma and she did it under Dr. Mala at a UPMC. But when I met Jamie, she was the first person that had been under Dr. Rosenberg. That kind of like what ended up sparking me reaching out to other people. And I can't remember when or where it was that we ended up connected. I think it was probably through one of our Facebook or other social
Right. One
media,
of the Facebook groups. Yeah.
but probably because I was connected to Jamie.
Right. Right.
But I mean, dude, cheers off to you and God bless you. I mean, I just kind of want to rewind for a quick second. When you were going through everything and then having your wife pass within 6 months of you getting treatment and then having 11 and a 15-year-old, I mean, I just, God bless you, man. Like I don't even know what to.
It was a challenging part of life, and you take it day by day, step by step. You get through it. I'm now remarried, now 10 years, have a blended family, 4 total kids. All our kids now are our youngest just graduated high school and now is attending American University, incidentally, within walking distance of NIH, which now takes me back to DC when I want to see her and see people I know out in the DC area. Going through any sort of cancer diagnosis and the treatments associated with it, it's such a roller coaster. It's all up and down. And certainly my story, it was compounded with my wife's cancer story being intertwined with mine. But ultimately, I just would like to say that I've step by step, day by day, I've overcome it and I've thrived because of it. It's certainly become part of my psychological and mental being a survivor.
Like I would imagine this has become like literally a part of your identity of who you are, right?
Absolutely, absolutely. It's definitely deeply woven into my identity and it's part of me, but I know that there's still so much I can give to the world outside of it too. So I'm grateful for Dr. Rosenberg's team giving me this bonus time in my life. And throughout my whole cancer journey, one of my mottos, I would say, going through it and living post cancer is Carpe Diem, seize the day. And
100%.
that's who I am.
I have to bring this up because I just got to, but you were the one who informed me last year that during September there was going to be the 50th anniversary celebration in Maryland for Dr. Rosenberg. Celebrate, him. It was a 2-day event, multiple speakers, and I really wanted to go. Really, really, really wanting to go. I had another event that was in Philadelphia. I know that you went. I know that I believe that there's some other patients I know that have been under
Yeah,
Dr. Rosenberg. You get to spend
right.
much time. then, or do you still get to communicate with him much?
I don't communicate with them much, but one of my desires and the reasons why I attended that conference, there were, to my knowledge, at least two other patients who were there, was to be able to talk to the doctors and medical staff who were there and express my gratitude and say hi and let them see the success of their efforts. And
It's so important.
it was an honor to be able to attend the conference, and it was really interesting because I positioned myself like in the third row of the auditorium, right in the center, and basically the speakers from session to session would always be sitting like right ahead of me. And one of the speakers of that conference was Jim Allison. And he was sitting right in front of me, and he went up and spoke, and he came back down, and I personally thanked him on behalf of patients for the work he's done. But it was also wonderful to see Dr. Rosenberg and Dr. Sherry, who I had mentioned, and the many other doctors who helped me through my cancer journey.
I gotta admit, man, like I saw some of the pics you had posted, and I was super jealous. I really wanted to be there. I was trying to figure out a way with travel and everything to be at two places in one time.
Unfortunately, you can't split yourself and do it.
If there's a will, there's a way, and I will figure it out. And I couldn't make it happen, but I was so glad when I saw your post about it and saw the pictures and everything, because that means both so much to you and to them. Because for a lot of the people that are working on these types of therapies and these treatments, they don't always get to see the actual literal results of their work, the proofs of concept that shows that, hey, these people are
These are real people.
yeah, they're the beacons of hope for the future that are gonna end up going or getting diagnosed and having to pick or choose or understand like what's out there. And I mean, it's huge, dude. It is huge. But it is extremely important. I mean, your long-term survival, I gotta say, and I can't do it enough, cling to that, because I remember specifically asking when I signed my consent, like, who else is out there? What are the resources can I reach out to? And one, because of HIPAA and all, but
The medical facilities can't connect us. We have to find each other.
it's up to ourselves. I'm a mucosal melanoma patient. We're a real small community. I had to reach outside of just the mucosal melanoma community. Then it hit me out. If I started focusing on, the community of the people that have received these types of treatments or this specific treatment, that I believe has one, a bigger impact, but two, a more larger reach of the importance of like what it is that's going on with this kind of research. Just like, yeah, I mean, you were a clinical trial patient, I was a clinical trial patient, but if it wasn't for you and everybody that came before you, and then all of your data that fed into the next research that eventually led to my clinical trial, and then none of that timeline of events happened, like it wouldn't be approved like it is now. And now it's approved.
Exactly. Yes. 1 year.
So, I mean, I'm just like mind blown. 100%. I appreciate you taking all the time to chat with me. I really enjoyed finally getting to see you face to face, even if it's virtually, having you tell your story in your words from your perspective. And I mean, I learned a lot, like literally just from what the difference is in having a federally funded NIH trial compared to a privately funded sponsor. For my trial, like I had to pay for all of my follow-up visits, both, maintaining insurance, co-pays, travel. And, I'm like, wow, dude, like,
Yeah. Deal with the millennia for me.
yeah, but God bless you, man. And thank you so much for just being there, being a member of, the TIL's Facebook group and participating in that. There are more people joining every day who that got tons of questions about what it's like going through the lymphodepletion, IL-2, what to expect, what to anticipate, just everything. And we'll definitely do a part two.
Absolutely. I could see perhaps a good episode would be talk about the psychological and mental aspects and how to the things I did to help get myself through this treatment and rebuild my life.
Yeah, multiple more episodes to continue from this because just the beginning. I'm so glad you brought it up. There definitely will be more. coming in the future. Like I said, Bill, man, I can't thank you enough, man. The long-term survivorship, your knowledge, your experience, your will to share. I mean, dude, it means so much, my man.
Okay. Well, thank you for hosting me. I'm happy to share my story to everyone, all the patients. Carpe Diem, and just take it day by day, step by step. Keep a positive attitude. It can work.
Absolutely, my man. And thank you, everybody, for tuning in.
All right, that concludes today's episode of TIL Talks with Chris White as we talk TILs, tumor-infiltrating lymphocytes, and all advanced cell and gene therapies. As a reminder, I am not a medical professional or medical expert. I am only a professional and expert on my story and my experience. If you are needing or seeking medical advice or assistance, please reach out to your care team. I'd like to thank my guest today for joining me on TIL Talks. To our listeners who have not yet done so already, please follow, comment, subscribe, share, and smash that like button. For more information about TIL Talks and related resources, please visit www.tiltalks.com. I'm Chris White. As always, sending love to everybody. Peace.